I'm going to explain what tear troughs are so that it can help you figure out if you could benefit from under eye filler. And if you do have tear troughs, stay tuned because I'm going to show you how tear trough filler can help lighten the darkness to the under eye area, making you look less tired and more refreshed. One of the best things that I love about treating tear troughs is the longevity of the results. Results commonly last over a year to a few years or more. In the past, we had videos that focused on eye shape and the upper eyelid area. And in this video, we're going to be talking all about the under eye area and the conditions that people can have to this area. A lot of times I have patients that think that they have under eye hollows or tear troughs, but they really have eye bags, which are completely different. So let's go over some surface anatomy so that you can understand how tear troughs or under eye hollows are different from eye bags, which are also different from lid cheek junctions. This is the lower eyelid and this is the upper cheek. The area where the lower eyelid meets and joins with the upper cheek is known as the lid cheek junction. The reason why we see lid cheek junctions is because the skin overlying the lower eyelid is thinner, and because the lower eyelid skin is thinner, it has a distinctively different texture from the skin that overlies the upper cheek, which is a lot thicker. So where these two different skin textures join is where we see the lid cheek junction and demarcation. Think of it like different lengths of grass on a golf course. The reason you see this demarcation in the grass here is because the grass is cut shorter on this side and therefore thinner in comparison to the grass, which is longer and thicker on this side. And the junction of where they meet is where you see this demarcation. These become more noticeable with age because with time, our underlying fat pads separate and there's loss of skin thickness as we lose collagen, elastin, and subcutaneous fat. Everyone has a lid cheek junction, but not everyone's is noticeable. And as a matter of fact, I had to get these beautiful women without their makeup on so you'd be able to see their lid cheek junctions, because most of the time when we see celebrities, they have makeup on. And when we apply makeup, we're actually trying to blend everything together so you don't see this lid cheek junction. If you are of East Asian, Southeast Asian, Pacific Islander, Native American, Central Asian, or Northern Asian ancestry, you're less likely to have a noticeable lid cheek junction. And that's because people of these ancestries usually have more fat and thicker skin around their eyes, so the transition is more blended between the lower eyelid to the upper cheek than that of someone who has thinner lower eyelid skin and less fat to the orbital or eye region. So, what is a tear trough? A tear trough or under eye hollow is a natural depression and sunken in area that goes from the inner corner of the eye and extends diagonally to the mid-pupillary area right here. Because it's a concavity or depression, it casts a shadow that can be very resistant to covering up with makeup like concealer. Having tear troughs can make people look more tired and not well rested. And it really doesn't matter how much sleep she gets, guys. This is genetic. Not everyone has tear troughs. It's not something that only comes from aging, although it can definitely worsen with age because we lose volume, but it's something that can actually be present during childhood, preteen, and teenage years. And you'll often hear people who have them, including myself, say that they've indeed been present since preteen or teenage years. And this is why tear troughs can be genetic. So let's talk about the interesting anatomy that causes it. This is the bicularis oculi. It allows you to close your eyelids. It surrounds the circumference of your eyes, spreading over the temple downwards towards the cheek. In some people, there's a cleft between the palpebral and orbital portions of this muscle, and this cleft explains why some people have tear troughs and some people don't. That, along with the lack of overlying fat and thin eyelid skin, also contributes to its appearance. Eye bags, on the other hand, also known as lower eyelid fat prolapse, are different. Eye bags are when you have a convexity or protruding raised area of fat that bulges and usually lies above the area of the lid cheek junction. Like tear troughs, eye bags are usually genetic, so if mom and dad had eye bags, you may have eye bags, but unlike tear troughs, which can be present during childhood and teenage years, people with eye bags usually don't notice them until maybe their mid to late 20s or 30s, and then it usually gets more and more protrusive and herniates more with age. Because eye bags are not a depression or concavity, they're a raised area as opposed to depression. Right now, the only true way to get rid of them is with surgery. Here's the thing, sometimes you can have both eye bags and tear troughs, and if you have an area of hollowness right underneath your eye bags, you can do filler here, and I've done filler for people who have had both eye bags and tear troughs with great results. As long as your eye bags are not moderate to severe and you understand that getting filler done is not going to get rid of the actual eye bags or puffiness. The herniation or bulge can worsen with age, and surgery is really the only thing right now to help remove the puffiness. When treating all three of these conditions, the idea is to have smooth, even, level skin. You don't want to have any convexities, and you also don't want to have any concavities. The goal is to blend the levels of skin and tissue, leading to smoother transitions. As mentioned before, one of the best things about injecting tear troughs with filler is that the results are quite often long-lasting. The first time I did my tear troughs, it lasted around 4 to 5 years. And then I injected them myself the second time utilizing the microcannula. That was in 2015, and it is 2021, and the results are still here. I'm not wearing any makeup on my skin and no under eye concealer right now, and I'm pretty happy with the results. I also feel that my under eyes or tear troughs never got as hollow as they did before treatment, meaning when I redid my under eyes in 2015, they never went back to being quite as hollow as they did before any treatment. So this is the microcannula, and I love using it to the tear trough area because the skin is so thin and delicate. So this is blunt, it is not sharp, and it is flexible. Instead of shearing through tissue like a needle would do, it glides through tissue. The tear troughs are something you don't want to overcorrect, and in some cases you want to slightly undercorrect this area because throughout the years we've realized that people can have issues with swelling to the under eyes if they're overcorrected. This is why this area can be difficult to treat. When you fill any area of the face with filler, it's going to attract water, and if too much water is attracted or too much product is placed, it can block the lymphatic drainage to the under eye area, and you can start to have a convexity or raised area, and that doesn't look very good. Now let's look at some before and after results. This patient shares her story on how long she's had her tear troughs.
I would probably say I've always had them, but I think it gets stronger the older I am. I would say I've had them since I was young, but since my puberty, I've sort of looked at them and it has just gotten much more since I got older. These like darker areas under the eyes that make me look rather tired and exhausted. And no matter how much I sleep or if I go on holiday, even for a week, I look exactly the same when I come back.
So here are her results immediately after getting tear trough filler. I would say that this patient had fairly deep concavities and depressions, especially on her left side, and you can see that the darkness under her eyes has been considerably reduced because we filled that sunken in area, and so it doesn't cast as much of a dark shadow. Her eyes look brighter, less drawn in, and more lifted because now she has a much more smooth transition from her lower eyelid to her upper cheek.
I feel amazing. It looks so fresh. It makes the whole eye area kind of pop.
This patient has eye bags along with tear troughs. You can see that she has a little more herniation and a little more darkness to her tear trough on the right side than she does to her left side. And here she is after treatment. And although she didn't have surgery to take away her eye bags or puffiness, this area doesn't look as puffy. It looks a lot less dark and brighter because we filled in the concavity, and now she has a smoother transition from her lower eyelid to her upper cheek. If you like content like this and you want to learn more about things like Botox, fillers, and Sculptra and how it can help you look more naturally beautiful, then make sure you subscribe to this channel.